I want to ask you a very, very important question. You have the option of fighting one grown lion or 75 house cats. Which one would you rather fight?
And that is what we call a cliffhanger. How you doing, everybody? My name is AJ Webb, and I am your San Luis Valley Health Wellness Coordinator. And the clip you just saw is a clip of me talking with Dr. Carissa Tripi. I was asking her a silly question then, but I had preceded it with many serious questions about joint pain. A lot of us have questions about joint pain. A lot of us have questions about what to do, where to go, how am I supposed to address this? And that's what we got to talk about in brief as we could over a 45-minute conversation. I myself met Dr. Tripi for the first time in 2013, experiencing my own knee pain and really having a difficult time getting around, moving heavy weights, and she sat me down, she got me on the right track, and I was able to get back into the gym, able to get back out in the field hunting and fishing and doing all the things that I like to do. Dr. Tripi is passionate about that, about getting people back to whatever it is that they want to do. Whether you're a college athlete, whether you're a granny picking up kids, Dr. Tripi is interested in helping you out. It's not really a shock to me that she has outstanding patient satisfaction scores because of the way that she treats individuals, because of the way that she provides and cares for us. And I'm speaking from firsthand experience that she's incredibly vested in getting you back in doing whatever it is that you want to do. And I think a lot of that comes from her own experience being an athlete, being injured, and understanding what a bummer it is that you're not out there doing the things that you like to do. She is a fascinating lady. We had a tremendous conversation about joint pain, what to do if you're starting to get it, how do you talk to your primary care provider about addressing it, if you're trying to manage it on your own, what are some of the tools that you can use in regards to ice and anti-inflammatories. Again, none of this is going to substitute going and seeing Dr. Tripi, but what I'm hoping is that you will be able to learn a little bit more about orthopedics, about what to do if you're experiencing some joint pain, and so that you can get back out and into the field, onto the court, whatever the situation is, and you can get yourself healed up, ready to go, and live life to the fullest. I know you will enjoy this conversation with Dr. Carissa Tripi. Enjoy. Hello, wellness friends. This is my asking face. And I'm asking you to please like these videos, please subscribe to this YouTube channel, share them with your friends, and leave some comments. That will show that these videos are being watched and utilized and supported, and that way we can continue to support sitting down with experts in a variety of different wellness fields and extracting the knowledge and the wisdom from them so that we can implement it in our own wellness practices on a day-to-day basis so we can all live happy and healthy lives. Please like, subscribe, comment, and share. Thank you so much. Thanks in advance. Goodbye. Disclaimer. Do not use this information as medical advice. Instead, see your own family doctor for care. The opinions expressed do not represent the opinions of SLV Health. Dr. T, welcome to my wellness cave, where all the wellness gets discussed. I'm really excited to talk to you because I've known you for a long time, right? Since I think like 2012 is when I first got to go into your office, but And so I've asked you a bajillion dumb questions, and I'm hoping to get some of those out so that we, the collective we, can take the information you have and better understand our joints, our joint pain, our injuries, and different things like that. But can you start off by telling me, what is your X-Men origin story? Where do you come from? What do you do here at SLV Health, and where'd you study?
So I get asked that a lot, and my usual response is I'm a mutt. I've been kind of not military mutt, not moved around that much, but
purebred mutt.
Right. But I grew up mostly in Florida till I was about 15. Born in Ohio, moved to Florida shortly after, lived there till I was about 15, and then moved over to the Western Slope in Colorado, Montrose, back when it was really a small town still. So went to the majority of high school there, went to Boulder for undergrad, and then sort of took off west or east. So went to medical school in Kansas City, and then spent probably about 7 years training with the Cleveland Clinic and through my orthopedic residency. Then I did a year of subspecialty training in sports medicine at the Henry Ford Institute in Detroit, and then ended up here.
Wow. Quite the adventure.
Right.
And you came back to do some fly fishing.
Well, my husband did, and
okay.
I'm a pretend fly fisherman. I'm a wannabe, I guess that's a better way to say
I'm
it.
the worst fisherman you ever saw. Biggest fish I've ever caught, smallest fish you've ever seen.
I'm a deep sea fisherman girl.
There we go.
That's what I like. Yeah, exactly. Yeah.
Very nice. Can you also tell us what's been your experience through sport? Because I understand that you played soccer at a high level. Can you tell us about that?
So soccer was my thing growing up. All through grade school, high school, and then just did intramurals in college. But that was what I lived, ate, and breathed pretty much. It was 24 hours a day. Soccer was on my mind. But as kind of my education progressed, you get less and less time to kind of dedicate yourself to organize sport and things like that. So I stayed pretty true as a soccer player until college, and then, like I said, I did intramurals, which is a little less structured. So I started throwing in rock climbing. Actually, when I got to Colorado was when I kind of started throwing in a little rock climbing, but still maintained soccer all through even medical school. Played on a guys' indoor team.
Wow.
And then as life just kind of, with the residency and training and stuff, got just a little more hectic, I kind of started to go more towards the individual sports, half marathons, triathlons, things like that. And then now I'm, most recently, big dirt biker. But have gotten away a little bit from that recently just because of an injury. But along the way, I've had many broken bones, many injuries, and probably 6 or so surgeries, all orthopedic related. So I think that's kind of why I naturally sort of went into the land of orthopedics.
Well, it sounds like activity has been a staple for, not only like for your fun and activity, but part of what makes you and how you like to live life. And being injured is a bummer,
right?
So what can you list? Like, what are some of the injuries that you've gone through and experienced and like recovered from?
So let's see. So again, as in grade school, every 2 years I broke a bone. Wow. Those eventually led me, obviously, to sitting out from soccer and things like that. So those were the more devastating things. When it pulled me out of soccer, my life was over for that 6 weeks or however long it took. So a couple broken bones. Let's see, where did my surgery start? I had a nerve injury to my elbow, and I needed that corrected. Wow. Something called an ulnar nerve transposition. That was in college. I had a knee injury, which actually, we thought we were going in for one surgery and kind of came out with another, which was in my favor. It was a knee scope that I recovered, luckily, fairly quickly from. I've had a broken ankle that was fixed, and then I had a nerve injury after that as a result of the fixation, and then had that taken out. I've had an injury to my hand called a trigger finger that would stick to the point where I couldn't get my pinky to kind of expand out, so I had to have that released. I just had a disc replacement in my neck back in July. Right. And that's gone really well. So I've had definitely some bumps with my recoveries, and things have not gone smoothly on everything that I've faced, but I've been lucky that I've always kind of fully recovered from everything. But I know what it's like to be out and kind of have to scale back or stop or whatever. So it's I'm with those people mentally when they.
I think that, I would only assume, all armchair quarterback, that's got to be incredibly handy that you have been in that position where man, I really feel for someone who's not getting out there. Let's get you back out there. Let's get you back on the field,
Right.
on the mountain, on the dirt bike, whatever it is. So, it's a dumb question, but has all those things, has that helped you become a better provider?
I'd like to think so. I like to think there was some benefit to that stuff along the way.
Right.
But I think, just from a very basic standpoint, I really can relate to people of when it's your first surgery, and it's been multiple surgeries, that sort of that will or that need or that want to get back sooner, get back faster, but then have someone tell you that you can't, and you want to be stubborn and say, yeah, but it feels okay.
I play through the plane.
Right. Yeah. So I've been to a point where I should have pushed myself and I didn't. I've been to a point where I should have scaled back and I didn't, and I furthered the injury. And I've been to the point where someone has told me, I know you feel good, but you still have to sit around I, in my younger years, was the kind of person who was kind of like, forget you, I feel good and I'm going to go.
Right.
And now in my older, wiser years, I'm sort of, I'm learning that, when someone tells me that in order to get what I want, I need to do A, B, and C, and sometimes that's scale back. I'm learning that that's the right and the faster thing to do to get back to where you want to be.
Yeah, it's definitely not instantly gratifying
Right.
to pump the brakes a little and go back to the drawing board and tweak something. But, wow, those are invaluable lessons. And through your injuries and through your sport, I think individuals that, fortunately haven't had to go through injuries, those are things that they, if they get really excited about something, they'd look forward to, unless they take the wisdom that you have and leverage it so that they can keep themselves healthy, which is a lot what I want to talk to you about. When I met you, I think it was in October-ish 2012, I had just hurt myself. So my background was coming from, doing a whole mess of lifting, training for football, training for sport. And at the time, I really didn't understand that all that training I was doing, a lot of it had to do with keeping me durable as someone who's going to bang and run and, hit and stuff like that. And I had, come out of sport, got into the 40-hour work week, gained a bunch of weight, lost it, and then started, refining it, lifting again, kind of doing these kind of CrossFit type workouts and stuff like that when I was first getting into it. And I PR'd my snatch and my clean and jerk, and just couldn't get my knee to work the next day, right? Because I had trained through lots of knee pain. It was, we used to eat ibuprofen like they were kids and stuff like that. But I finally got to this, this injury point where I'm like, whoa, this thing is just not working. So I went into your office. You took a look at my stuff, and I'm, being, I don't know if it's typical for someone to be this, self-diagnosed. Oh, I think it's chondromalacia. Like all these things you think it is. But you gave me some advice that I still think about today. You were the first person to ever tell me to rest, and I listened.
Well, I'm honored.
Yeah. So, what had brought me there, but, that was like a nagging thing that had been leading up for a long time, and I was going into like real intense ranges of motion and chasing performance. I was going quantity over quality, and getting into, and I just got myself hurt.
Right.
And fortunately, I was able to pump the brakes, rest, take some anti-inflammatories, and make a reasonable recovery out of that. But I very well could have taken, some painkillers or something like that and just kept going.
Right.
And I look back and reflect on that because I had kind of bragged that I never really got hurt, lifting or anything like that through college. Like I'd had some catastrophic stuff where people were like, I got high load a few times and stuff like that. But I always just, no, that stuff doesn't hurt me because I do it good,
Right.
But the truth is I was surrounded, I was in a system, that sport, that high-level sport where you have all these different things at your disposal.
Right.
You get to see, a team doc on a semi-regular basis. You have basically someone to give you PT on a regular basis and preventative stuff. So, hey, go and, grab this and grab the rice and do all these different things that I just took for granted. And not all of that stuff is unattainable. A lot of folks can do a lot of those things at their house. So I kind of want to take this unique experience that you and I have had about being injured and being a part of sport, and then break it down into ways that people that are working to train for something, whether it's, picking up kids or running their first marathon, and take some of the components of that. Can you tell me what are the things that you see on a regular basis, as a practicing doctor of orthopedics?
Well, I mean, as it relates to the athlete, whether it be the weekend warrior or some of our professional athletes either that are here in town, in general, a lot of it's kind of the same. There's some common themes. A lot of it has to do with whether if you're an established athlete, then it's usually an overuse injury.
Okay.
And if you're kind of just getting into working out again or something like that, or you're playing softball on the weekends and you hadn't really done much to prepare for that, then it's not necessarily overuse, but it's usually a pain or an injury that arises because of a muscular imbalance. And that's just because, if you're out of sport, you're out of activity, and you go back to that weekend warrior stuff, or you decide you want to do a 5K running plan, but you're going to skip to the 5K, your body's not ready for that kind of stuff. And so we get these kind of sort of accentuation, if you will, of muscular imbalance, and your body's going to talk to you if it's not balanced. And so, that run that you pushed, 3 miles on or whatever, when you're supposed to be at a half mile or something like that, your body's going to start talking to you because, that type of activity is really just going to kind of bring out the weaknesses that we have. And then in terms of the, overuse stuff, we have, again, professional athletes in the Valley that we treat, college and high school, and we sort of run the gamut here, and we see these people who are at the top of their game, top in the nation, and they are still getting injured. And believe it or not, that has a lot to do sometimes with muscular imbalance too. Actually, a lot of it does. So I think the root, if I had to kind of pick one thing, it would be sort of almost like a deconditioning. But it's usually not what creates pain or injury is usually not a global deconditioning. It's usually an imbalance that your body's trying to deal with, and it'll sort of flare up things because of that.
Right. So it's not necessarily like your whole body is weak in areas and you're, weak overall. It's you just happen to have a tendency or a default to one side or the other or a certain particular movement pattern.
Yeah. Or like you were kind of saying, we gotta go to office jobs and things like that, and our posture, everything about our day to day. If you're a desk person or an active person, is in our society, especially we're like this,
right, hunched over, sitting in a chair right now, right. So for me to expect to leave here after 8 hours of this and then go into full range of motion exercise under heavy load, I could be setting myself up for some trouble there.
Exactly.
Right?
Yep.
But at the same time, I'm not a sissy, and
right.
I think one of the things I heard you saying is that pain's telling you something. Pain is letting you know. It's a signal. That's saying, look, there's some things that we can work on here, and that you either need to pump your brakes, go back to the drawing board, or there's going to be some consequences. Continuing to pop ibuprofen is not going to be a sustainable strategy. It's
not the way to go.
Which is an interesting thing, because I think back to it, in the you got 4 years eligibility. You have this finite time, but the game changes as soon as you leave.
Right.
As soon as you leave that arena, right, where you're no longer your performance. It's okay, but you're generally speaking, you can be just adequately strong and flexible and all this other stuff. But then to go into the longevity, and just longevity is not as fun to think about as performance.
Right.
Do you think that that's like in your experience as chasing performance? Has that ever been something that's got you in? Got you in trouble?
Yeah, absolutely. Yeah, where you're not thinking about the long term, that I want to remain an athlete for my life, and so I want to remain healthy today, tomorrow, and next week in order to continue to do that. You're thinking, I want to do this lift. I want to accomplish this skill. And something's telling you, you know, body wise or brain wise, maybe not yet. Maybe you're not ready, or maybe that's too much, or maybe you got that little kind of, you know, voice of reason, if you will.
Yeah.
And you don't listen to it because you want it now.
Right.
And then that is a lot of times what ends up sidelining you and keeping you from furthering your goals, whether it's 4 to 6 weeks or whether it's a couple of years. If it's, if you don't listen to pain and it changes to injury, then you're in trouble.
That is not good.
Right.
Right. Okay, because you just undercut yourself on the things that you ultimately want. So let's think about that athlete, experience, right? So you're part of that whole ecosystem right there, where you're working to get athletes back on the field, but you're also talking to athletes that are starting to experience those preliminary signs of pain and stuff like that. Let's talk about how to never come and see you.
Right.
What are the things that an individual can do to avoid some of these different chronic? I mean, you can avoid the catastrophic ones by staying in your house and
right.
and not having any fun. But that's not. But let's focus on the chronic components of it. Those overuse injuries or the or some of the asymmetry type situation. What are the things that they can do to not have to go and see you?
Right. So let's talk maybe about how to prevent it. Some ideas of how to prevent, and then let's talk a little bit about. Okay, so here you are with pain.
Right.
What do you do to stay out of your...
Oh, yeah. Very official here. Prevention, management, and then intervention. I don't know if that's anything that you use, but I was thinking, okay, I'm hurt. Then...
Right.
Okay, but anyway, so yeah.
Yeah, so in terms of the preventative stuff, I know you've had Dr. Corey Jones in here, one of our awesome physical therapists.
Yeah, we talked a lot about warming up, what causes injury, and things like that, and how to cool down.
Yeah, I think she may have discussed some of the screens that they do upstairs, FMS or SFMA. And
functional movement screening, sports functional movement screening?
It is, oh man, I'm going to kill you for asking me this.
I'm sorry,
it's functional movement screen, and I'll come back to it. I'll remember it.
We'll put it in notes.
Okay. But so if you are someone who's kind of living a relatively sedentary life right now, or maybe you're not sedentary, maybe you're a runner and you want to do something else, lifting, or if you're about to change your game, the best thing I think you can do in terms of preventative stuff is to get an FMS screen with our physical therapist group. And that's just not a plug just for them to kind of create business, but...
No, I totally agree. I got to go through one. It's like, whoa, that really highlighted some holes in my game.
Exactly. And it's stuff that you don't know as you walk around in life. Those inadequacies or those asymmetries are not going to present themselves. But the minute you take your Zumba class, they will.
Right.
So the idea behind those screens is for you to come in as healthy as you can, so without pain or injury, and you go through this screening process where they take you through some seemingly easy things that you should be able to do as a functioning human being.
Put your foot over this.
Right. Exactly. A balance this way, and it's amazing the little things that this screen kind of picks apart and identifies for you as either a current athlete or a future athlete. And so, the wealth of information, I mean, I don't think I've ever seen, I lied. I've seen one Adams State athlete, pass this test.
Yeah.
Everyone else,
very tough.
Yeah. Whether you're at the top of your game or whether you're an Adams State athlete or a great high school athlete, everyone fails in some capacity because these are not movements that we use in our day-to-day life, but they will be something that you use as an athlete. So highlighting those and educating yourself about where you can improve as sort of a functional human being, I think is a great way to start, because then you're not going to get those overuse things and a chronic injury and stuff like that. If you spend some time kind of with the prep work kind of stuff, if you're, if you work on what they tell you and what they identify for you, I think it's like invaluable information.
Definitely.
The other thing in terms of preventing needing your orthopedic surgeon is when you're undertaking, again, a new exercise program or you're expanding the one that you're currently doing. I think the best piece of advice that I could offer is do some cross training. So that cross training doesn't have to be that you swim and you run. It can be that you do yoga and you run or something, because a lot of our sports, say for example running, which is very popular obviously around here, we are kind of moving linearly, and we are not working a lot of our muscles that go side to side, and that's something that FMS screen can help point out for you. But in order to avoid the chronic overuse stuff, it's to be a better, well-rounded athlete. And so spending some time outside of your individual sport is going to benefit you. So for example, football, when you played in college, you did weight training, you did agility, you did football itself. I mean, you sort of many facets of being a football player, and a lot of that's cross-training stuff. You know, you're hitting two different sort of skill sets, whether it's strength and agility. So that would be sort of the one piece of advice I would say that was going to prevent that chronic overuse or new onset injury, is to spend some time doing a movement that is outside of what you're kind of after.
Yeah. So broadening your horizon, so to speak. So whatever it is that you may do, consider something that looks a little bit on the opposite end. So you run a lot. Think about incorporating some full range of motion gymnastics types, situation. Just start cultivating general physical skills, general physical preparedness. Because I think that one of the things that when you start putting together a workout plan, everyone wants to optimize every single day, meaning that you made the best possible performance, and that's not realistic for a lot of reasons, and you're not going to maintain a linear progression off into the sunset and get better every time. That there are different components of exercise, and I like to break it down into a conditioning type, where you're doing something that you're probably pretty good at over and over again to build stamina, maybe get your heart rate up. Practice, where you're acquiring new skills, even if it's something you could probably move some more weight, but you're keeping it toned down so you can really focus on that movement pattern. And then testing, and we kind of want to test every day. How much can I in this amount of time, or I'm going to PR this 5K, this lift, or whatever it is. And by looking at those three things and kind of having a balance, but also having a balance of the general physical skills, and ranges of motion and stamina and power and speed and strength, that we can put ourselves in a position to be healthy in the long run and to move and be able to enjoy the things that you don't have to ignore the things that you really enjoy. If running is your gig, go and run. That's
absolutely
you,
yeah.
But at the same time, consider, even though you might stink at it, do it in your living room, put the yoga tape on, and
exactly
in the privacy of your own home, practice something new. Awesome. So there we go. To stay out of your office, look to identify some of those asymmetries that we have, and see if you can get some help, some coaching from those functional movement screenings. I got to go through one of those, and just to understand how much difference my external rotation is. They've really put together the ideal ranges of motion for everyone. And we said the words like tough and difficult and fail, but really they're going to ask you to do some tasks that are simple that an ideally functioning human will be able to do. And but the thing is, we don't train the whole day to be an ideally functional human. We sit, we do these different things for ourselves.
Exactly.
So identifying those things can help you stay out of there. Broadening your horizon. What about if I'm already experiencing pain and discomfort in my workout? Kind of when do I need to start thinking about talking to my primary care provider? What's that process look like? How do folks end up in your office?
Yeah, so the first piece of advice I could get when you're, again, whether established athlete or newer to the game, is to listen to your body. When your body when you are feeling pain, there's something wrong, and that doesn't mean that it's an injury. It doesn't mean that you're going to, if you listen to it, that someone's going to tell you have to spend 6 weeks out of running or whatever. But you need to listen to those little, small, kind of quiet cues in the beginning, because if you don't, they will amplify until you're out of your sport, whether temporarily or forever. And so if you're getting a little aching elbow pain, you're getting a little aching hip pain or knee pain, listen to it. Don't keep ramming your head against the wall, trying to go back to that Zumba or that CrossFit or running or whatever it is. Your body's telling you something's wrong. And so to not pay attention is going to create injury.
Gotcha.
And the other good thing you can do in terms of, okay, so now you have it. Now you've got a knee that's aching. Now you've got a hip that's aching. Beyond, scaling yourself back. And again, that doesn't mean, especially for all of us, come January, we want to, start a new wellness program. And it's January 2018. We're all going to be, Barbie.
Yeah. Exactly.
You want to create that habit for yourself. So you don't want to take yourself out of going to the gym every Monday, Wednesday, Friday, because you're kind of nursing an injury. If your knee hurts, go to the gym on Wednesday, but do upper body. So keep in mind, your bigger goal is to create habit or to continue to progress as an athlete, and you can work around an injury,
right?
So that you're not taking yourself mentally out of that.
That's I think a good takeaway is that your knee's bum, but you're still going to want to get in there. You're still want to do some moving around.
Right. Just avoid it. Sort of if it hurts, don't do it. I mean, that's really what it comes down to.
My pal Will, who's big into CrossFit, he had put together. He needed Tommy John surgery, right? It's ligaments in the elbow.
Yep.
He had hurt it doing a very heavy snatch, and he kind of documented his recovery. And he's look, I need to get back into the gym. It's good for my overall well-being, but the number one thing I need to do is respect the pathology.
Right.
To respect the injury, respect my range of motion parameters and those types of things. But still, it's it's still a good idea to get in there and do something, do some kind of movement. I even understand that by doing that, you can increase your recovery time, even though you're not using your particular thing. That you're going to be better off for it.
And in a lot of ways, yeah. It kind of goes back a little bit to sort of that cross training method, or doing something outside of one singular movement. So, we're getting a little off, or I'm getting a little off, but like, for example, ankle injury, ankle sprain, we used to, when it was more severe, we used to immobilize and, sometimes even cast in severe ones. And now we've learned like immobility is the devil when you're, with an ankle sprain. And so
you finish up a surgery, you want to get somebody up and moving pretty
exactly.
soon, right?
Yeah. We don't immobilize anymore, really. I mean, it's pretty rare, especially for like those common injuries that we see day-to-day stuff, the chronic stuff. And so keep moving would be kind of the first piece of advice. But don't move in pain. So, again, if it's I see a lot of chronic knee stuff, especially in our female population. It tends to hit us a little bit differently because of our anatomy. Our hips are wider. It pulls differently on our kneecaps. And so most females are a little more predisposed to problems about their knee. And so I see a lot of that in the office. And it's sort of if you get into a new exercise program and you're doing squats and lunges and your knees hurt when you do squats and lunges, don't do squats and lunges for now.
Right.
Like you said, respect the injury, respect the pathology, and give it a chance to sort of. Your body will heal a lot of these injuries on its own if you will listen to your body.
Yeah, we have an incredible machine. Like for you to tell me to rest and to take my medicine and be compliant to what you recommended for me. Game changer.
Right. And it's so simple, right? I mean, it's like, but it's amazing how much just some relative rest is going to help those injuries. The key about the rest part of it, though, is to do it. Be proactive about that. So don't wait until you've been running with shin splints for 3 or 4 weeks. Right. I mean, certainly rest is still a part of that treatment too, but it's going to take much longer for your body to respond to conservative measures when you've been sort of hitting it up against the wall all the time and creating more and more and more and more pain. So being proactive about listening to your body and giving a little bit of relative rest or working around that area is going to go a long way if you listen to it early on.
Yeah.
And then the other stuff is like good old fashioned, like rest, ice, compression, elevation stuff. I mean, it's the stuff that, we used to do when we were kids or whatever, throw an ace bandage on it, but inflammation and swelling and things like that oftentimes is a good thing. It's your body's way of healing a lot of things, but it's when the swelling or the inflammation interferes with range of motion or is associated with a lot of pain. That's when we kind of want to address that inflammation and that pain. And so So along with some relative rest, ice is a great anti-inflammatory.
Mm-hmm.
So putting some ice on there, and if it's sort of a new injury or something, an ankle sprain or something like that, you're going to want to do that pretty frequently in the first 72 hours or so.
Right.
Every, 20 minutes of ice every 2 hours or something along those lines to help decrease that inflammation so that you can maintain mobility, and just kind of help the recovery and not lose so much strength as you're rehabbing. That those sort of fundamentals of listening to your body, protect what hurts. And then, if you're experiencing swelling and pain, doing those modalities like ice compression, elevated if there's a lot of swelling. Anti-inflammatories over the counter have a role as well for a lot of patients, not everyone, but all those things are things that you should be doing as an active person,
right,
to help yourself.
Yeah, as the person who's in charge over you, your meat vehicle, and how you move through the universe.
Right.
So let's talk real quick just about what is what's proper over the counter anti-inflammatory use. I used to take an ungoogly amount of ibuprofen. I'm talking like 6 before weights, which would be like 1,200 milligrams, so, and then, some after weights, and then before practice. I mean, it was in the context of sport.
Right.
Don't plan on doing it again, but I know I was probably, I was definitely overdoing it. And
right.
Probably my youth could buffer those
right.
consequences, right? But for now, I exercise a couple times a week. I'm just kind of a regular guy. Every once in a while, my knee kind of. What's a good way to use over-the-counter anti-inflammatories to help manage a situation?
So over-the-counter anti-inflammatories, we're talking about things like Advil, Aleve, ibuprofen, Motrin, those types of things. And those all can have a role in an injury, or even kind of prevention of injury when you're starting to get that little bit of a nag. Kind of cutting down that inflammatory response can be helpful. Now, anti-inflammatories are... more and more, we're kind of learning more about the potential detriment of anti-inflammatories. And so there's some people who are not good candidates to take that, and you want to check with your primary care doctor, of course. But if you've had an ulcer in the past, if you have a significant cardiac history, meaning that you've had a heart attack, or you've had a stroke, or significant high blood pressure, things like that are sort of reasons why you may want to stay away from those types of medications.
Okay.
Again, an inflammatory response is actually a good thing in the body for the most part, but also, again, controlling the swelling and things like that, controlling the amount of the response can be helpful in terms of the quickness of your recovery too. So the way that I recommend patients take an anti-inflammatory, if I'm going to prescribe it, is that they start with 2 weeks every day. They take their anti-inflammatory, whether you think it's working or not. An anti-inflammatory needs to be built up in the system in order to an anti-inflammatory. It can work here and there. You take it for a headache, it's a good painkiller. Yeah. But in order for it to be an anti-inflammatory, which is what we're after, it's got to have some buildup in your system with consistency. So I usually tell them take it every day for 2 weeks, and again, whether you think it's helping or not. After that 2 weeks, go off it. If you don't notice any change, stay off it. If you notice that your pain is coming back, go back on it for another 2 weeks, and then done. I don't care if you have risk factors or not. It's just a medication that we want to pay a little closer to attention to as we're learning more and more about some potential side effects of it. So it's still, for the majority of people, a very safe medication, but we used to put people who have like arthritis or something on it every day chronically, and we're learning that that's probably not the best thing for our bodies to be on that because of other processes that it can interfere with. So in my practice, I use an anti-inflammatory for a very short duration, and then you're done whether you think it's helping or not.
I got you. Well, that makes more sense. Yeah. So the six before weights, 6 after, not a good thing. But at the same time, I swung to the other end of that. Like I overcorrected and said, I'm never taking that stuff again. If I'm moving right and I'm eating right, I shouldn't even need that stuff.
Right.
But really, it would have probably helped me out. It's very acute. situations under just being smart about it.
Yeah, exactly. And I think, in your setting as a collegiate athlete, the rules are a little bit different than you and I as we sit here today and as we're athletic today. I mean, if you, as a sports-minded provider or physician, I'm going to listen to your situation if I'm giving you advice on whether or not you should listen to this or whether or not you should push through. Right. It matters to me if you're in your senior season and you've got one game left, or you're a freshman. I'm going to approach that differently, and I think, in my opinion, so should you. So should the athlete. Yeah. I mean, if there's a lot on the line emotionally and physically and career-wise and stuff in terms of that sport, then go ahead and play through that pain on your last couple of games, and let us try to help you with anti-inflammatories, things like that. But if the for the common athlete, the day-to-day person, backing off is the smarter thing to do.
Right. Well, I think that one of the things that I work to kind of think about through the wellness program is, I hear so many folks that are so upset that maybe someone left. Oh, that was my doctor, and then they left. Right. But we are the common denominator in our health and our wellness and in our movement. And we got to, take a lot of responsibility. Because I was just, in 2012, I was there to see what you were going to tell me. That was the end of my thinking process right now. Right? I wasn't going to vet it up. Well, I don't know about this anti-inflammatory, or whatever it was. But we get, by stopping thinking, looking at the context of what's our new life sport. Right. Whether it's chasing elk during hunting season, crossfitting, marathon, whatever it is. And we factor these different things into there. We can make some higher quality decisions, and we can take advantage of your expertise and make it your job easier and our job easier. I want to kind of so let's get into the intervention component of this. When is it time to really start considering a surgical intervention? I mean, I know that's you've ideally had a relationship, and just tell me when is it time to get cut? Yeah,
surgery is a last resort. Should be a last resort for the majority of injuries. Now, there are things like ACL injuries and things like that where the surgical option actually is the conservative option. Okay. So if you're especially a younger athlete who's recently torn their ACL, there's a lot at stake with an unstable knee, and that's something that we sort of potentially as surgeons are going to jump to surgery or recommending surgery differently than if you are a 40-year-old athlete who I tore my ACL in a softball game, but since then I've been walking around, I'm not unstable with my knee, things feel okay. We're potentially going to approach that injury differently. Right. So there are times when surgery is sort of, listen, this is what you need. And that's kind of, I think, most exemplified in our younger athletes with ACL tears. Without an ACL, as you continue to be an athlete, you risk injuring your meniscus, injuring the cartilage in the knee, and then that increases your risk for earlier onset arthritis, and kind of the snowball begins there. So, but for the majority of other things, we want surgery to be the last resort. And that can be frustrating for a patient to come in, because you're coming in and saying, I've had this pain right here for a whole year. People tell me it's tennis elbow and I can't get it to go away. And I've worn the strap and it doesn't work. So what I'm going to tell you is you need to spend more time wearing the strap. You need to spend more time, and we need to get you into physical therapy. A lot of times you're coming into our office because you're fed up. You want something done. You want something different.
Right. You think about this.
Right. Yeah. But a lot of times,
my responsibility.
Right. But a lot of times it's the surgical option is not a good option. And sometimes it is a function of just taking you through all of the conservative things first, which usually for me, has something to do with physical therapy along the line for the majority of the injuries that we're kind of discussing today. And so we sort of as surgeons want to prove that you need the surgery. Okay. Because
that's fair.
Yeah. I mean, there's a lot of risks with surgery, and surgery is oftentimes really successul. So you hear, oh, my friend got their knee scoped and they were, back on their bike next week.
Been 10 years.
Right. Yeah. But with the wrong patient, that surgery is going to be a disaster. Right. With the wrong pathology, that surgery is not going to work, and you're going to be unhappy that you went through a surgery and you didn't get the relief that you expected or wanted. So a lot of when do you operate is it has a lot to do with what has the patient already tried, what have they been through, and then what are the reasonable expectations as a result of the surgery. So something like, for example, carpal tunnel, which isn't necessarily a sports injury, but we see that frequently. People come in, their hand is numb, tingling, they can't sleep at night, they're constantly shaking it, and they want that gone. Well, the surgery is not going to necessarily make that gone. It's going to stop the progression of your symptoms. It's not going to reverse them, or at least we don't know if it's going to reverse it. We know with a successful surgery, it's going to stop the progression. But so there's a lot of education that needs to happen about realistic expectations with surgery, because again, surgery oftentimes is so successful that we think it's kind of the home run. That's all I need. And oftentimes that's not the right answer. And so as frustrating as it is when you've had that injury for 6 months and it's not getting better, and you feel like you've tried everything, and you go to a surgeon's office and then they say, go to physical therapy. Rest. Right. Or rest differently. Right. We get that that's frustrating, but we also get what an unsuccessful surgery is too. And so we want to protect you from that. Of course. So there's a lot of indications for surgery, and we're kind of obviously talking really broadly about it, but in terms of when to get into your PCP or orthopedic surgeon, so, when to pull that trigger. Enough is enough. I rested, I put on my ACE bandage, I did all that stuff. When do I kind of say, I need help, someone needs to look at this for me? Of course, if you can't bear weight, or if you can't use the extremity, that deserves an evaluation sooner rather than later. And then there's a couple other sort of big red flags that mean more nerve injury, so neck injury or low back injury, and we certainly see that a lot as people ramp up their exercise program. And so if you're getting numbness, burning, tingling in an extremity, especially if it's going all the way down the extremity, like into the fingers or into the foot, that's a reason to not wait. You want to see someone sooner rather than later, whether it's your chiropractor, your PCP, or an orthopedist. If you experience weakness on one side, so you're right-handed, you use your right hand for everything, and now when you go to grab the carton of milk on the top shelf, you not that you just have pain, you have no strength there, or you're noticing a difference in your grip strength or things like that, that sort of comes out of the blue. That can be an indication of a nerve injury, and or bowel or bladder changes. That's like a don't wait, go to the emergency room kind of thing. And so those are kind of the indications of don't wait on this kind of thing are relatively small, and they have to do with when we're getting into the spectrum of nerve injury, which can happen from a herniated disc in your neck or your back or things like that. Those things you don't want to let go. You want someone to evaluate that, and oftentimes that doesn't need surgical intervention or anything, major, but we want to make sure that it doesn't, so that we give you the best chance for a successful outcome and successful long-term relief. But almost everything else can kind of wait a little bit. You can kind of work around it, play with it a little bit, and oftentimes as the surgeon, it helps me to know that not that you got hurt yesterday and it hurts to walk today. It helps me more to know that you got hurt 3 weeks ago and you still are having difficulty walking. Gotcha. That trips a few different switches in my brain.
Right. So there's a machine going on.
Exactly. Those are things that are maybe outside of the box of a normal sprain, strain kind of thing. So giving it some time, again, paying attention to your body, but then when you've given it time and you've done all of grandma's remedies types of things and you're having difficulty, with movement, then that's a good time to get in with us or your PCP.
Gotcha. You talked about several of them, answers to this question I'm about to ask you, but as eager as I was to feel better, when I originally came to see you, you had to synthesize a lot of noise too. Blah, 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 I think it's this and this is this and this is what happens. What is the information that really can help you help me? What is something that I should just skip that when you're coming to see Dr. Tripi? Just don't even explain that part. What is it that I can do as a patient to help you, the doctor, help me?
Yeah. Well, so first of all, you should always have the opportunity to explain what you're feeling, no matter what words you use. So, I mean, honestly though, because a lot of times you don't know what's important, and that's for me to pick apart, like you said, it's for me to kind of synthesize. And so, of course, we've got appointment times, and we kind of have to, be respectful of the next patient's time. And so I sometimes can't sit with you for a half hour and listen to you talk about, now that you're 50 in high school, you had that one injury. So, right. So exactly. As much as I love the stories, but so part of me trying to synthesize that is listening to you kind of just give it to me. But if I had to kind of have a checklist of what I want to know when you come in, I could synthesize the same data by you saying A, B, C, and D. Right. In the time that it sometimes takes you 15 minutes to explain how you got here today. Right. And a lot of that is, where does it hurt? Where, not your knee, where on your knee? Right. Where does it hurt? When does it hurt? So sitting, standing, walking, squatting, kneeling, that kind of stuff. At rest, not at rest. At night it hurts more than during the day, those kind of things. So where does it hurt? When does it hurt? What does it feel like? Sharp stabbing, achy, dull, that sort of thing. And then how did it start? So what were you doing when you first felt that? And that's sometimes hard to really pinpoint. But telling me that you have hip pain and you just started Zumba class is different than you telling me that the pain started out of nowhere. Right. So those, I think, are for me a lot of the key things. And then what makes it feel better? Okay. Is time making it feel better? Is it when you I often unfortunately hear, well, when I made this appointment it hurt a lot, but it took a while to get in, so now it's not bothering me that much, which is great. But that goes back to the give your body some time to heal it on its own. Right. Because your body can really do some amazing things in terms of healing it on its own. But yeah, I think that sort of that who, what, when, where kind of thing is really helpful, especially to know where. Gotcha. Where does it hurt? Because a lot of times it's knee pain and that's stopping you. It's shoulder pain and that's what stops you. But to tell me that it hurts here versus here is astronomically different. Yeah. So keying into the where, when stuff.
So if you can work to be specific about what it is you're feeling and then just but feel okay with going through the process of getting on the same page as you. Okay, that makes me feel better. Because it's just one of those things where you could be confused, you could be uncomfortable, and you're just like you're either legitimately searching, or you're just like, man, I hope she says that I need surgery or whatever.
Right, exactly.
I mean, I'm sure there's just tons of different things that that go through. So that explains a lot. So I know that you are a very popular provider in regards to folks say, man, go see Dr. Tripi. She can really help you out. And just to hear you say, you know what, listening is a big part of it. I can see why. And I didn't even go as far to say, but between listening and then really caring about kind of that outcome, getting back on the field. Like I know that you even walked someone through their senior thing in the middle of the football field, and there was someone that you had helped out, right? Can you tell us a little bit about that story? Yeah,
I mean, it was an Adams State football player who this is what you're talking about, right? Yeah. So a kid who had a shoulder injury early on in his collegiate career, and he came to us, and I had the opportunity to help him out with that, and he had to have surgery to stabilize his shoulder, and he was sort of the model patient thereafter. He did his physical therapy. He did everything that me and his physical therapist told him to do, and he ended up with an excellent outcome to where he was back in next season. Wow. And he had a successful collegiate career at Adams. He did awesome, and he was fun to watch too. And so, this, I think like anyone, probably any surgeon, especially sort of us as sports medicine surgeons, we want to see what your end game. That's what we're after too. I don't, in that athlete, I didn't fix his shoulder so he could sit on the couch. I fixed him so he could tear it up on the field and so
express himself physically.
Yeah, and not worry about his shoulder injury and just be 100%. And so he was able to achieve that, and it was fun to follow him for the next couple of years while he was at Adams. And it matters. I think it mattered a lot to me how he did. I think he knew that, and I think that's the case for sort of all my patients. But it was fun because I provide coverage over at Adams State and cover the football games, and so we got to see each other a little bit more regularly than my average patient who's done well and then doesn't need me anymore. Right. So that was a really valuable relationship to me. He was a good kid.
That's awesome. Well, good job. Not only, on the logistical and stuff like that, but also, I don't know, those, we come to doctors in, such vulnerable states, and we know that they're invested in us too, and that's awesome. That's amazing.
Yeah, and that I think a little bit goes back to when someone tells you to rest or someone tells you to go to physical therapy. Believe me, it's not lost on me when I'm telling you can't do what you want to do. Right. It's a big deal to me, but I'm trying to get to the same place you're trying to get to, and I'm trying to get you there as fast and as safe as we can get there. So yeah, I think that sort of, kind of listening and, sort of, I don't know, just having a mutual trust and respect, I think is really important as a provider or a surgeon or whatever, knowing that I'm not sending you down the path of, inability. I'm trying to get you where you want to go.
And one of these people now, get over here.
Right. Oh, you're just telling me that I can't play.
You're damaged. Yeah.
Right. There's not any of us in the orthopedic department that are going to tell you that you can't play unless you can't play. Right. And so, we have the same goals that you have, and we care about it. You're not just another patient that's kind of coming through the door and we're on to the next. Your specific situation and what you're trying to get back to is individual, and it's important. And so your care should be that way.
Outstanding. Dr. T, anything else that we need to know about how to either help you or how to take care of ourselves? We could probably talk 1.5 million years about diet.
Right.
There's a lot of things that we can, that we go to. So maybe we can figure out an episode 2. But I want to ask you before I let you go, I want to ask you a very, very important question. You have the option of fighting 1 grown lion or 75 house cats. Which one would you rather fight?
Grown lion.
Grown lion?
Going down in flames.
It's a way better. I couldn't even imagine 75. That's too, it gives me anxiety even thinking about it.
A little more pride in the lion, and fight the lion. So I'll go down with the lion before I beat 75 house cats.
That'll be a better, start eaten by a lion instead of eaten by 75 meow meows.
Right.
Dr. T, thank you so much for sitting here and we can explore these different parts about joints and joint pains and when we need to talk to you and how we can help you. My hope is that we can take this information and someone can go, yeah, time to go talk to him, or time to start listening to him.
Right.
And so thank you so much.
Thanks for having me.